Hello students, this is Dr. Ways and welcome to your lecture on the mediastinum. In order to talk about the mediastinum, we need to talk about two specific structures that form the lateral boundaries of the mediastinum, and that would be the pleura of the lungs. Pleura meaning the double-layered serous membrane that surrounds the lungs, which we kind of talked about in the previous thoracic wall lecture. So remember, pleural membranes, or any kind of serous membrane within the body, has this double layer appearance where the outside is referred to as the parietal membrane, and the inside that's actually attached to, the inside that's actually attached to the organs, in this case the lungs, would be the visceral membrane. Since this is associated with the lungs, we call it the pleura. And always remember that in between those membranes, we'll go to this picture right here, there is a potential space filled with a serous fluid that prevents friction as the lungs expand and these membranes slide across one another. Now if we start here at the apex of the lungs, we see that the pleura is called the cervical pleura, also known as the cupular pleura. You might see that in, in fact, it is in your bare bones workbook. As it traverses down and into the recesses between the lobes of the lungs, we refer to that as the costal pleura, the costal part of the pleural membranes. And then we head down towards the bottom, and here you notice the pleura goes all the way down to about the 10th rib and then comes back up, but there is no lung down in that space. We call that the costodiaphragmatic recess, the costodiaphragmatic recess, and we'll talk about the importance of that recess after we get through talking about the different parts of the pleura. As we head back up and go along the diaphragm, that is called the diaphragmatic part of the pleura. And then as we head up towards the root of the lung, or if we start at the cupular part and down towards the root of the lung, this section is referred to as the mediastinal part. All right, and it's called the mediastinal part because, as we said earlier, this forms the lateral wall of the mediastinum on either side. There's also a section in the anterior part right in this area that you can't really see here that is known as the costomediastinal recess, which is another potential space like the costodiaphragmatic recess. Now going back to the costodiaphragmatic recess, which again is this space right here, and notice that you can see it right here as well. Lungs would be about 1, 2, 3, 4, 5, 6, 7, would end right about here. All right, so after rib 7 and the 7th intercostal space, that is where you'll have your costodiaphragmatic recess. And the reason why you have this recess is so that when you have strenuous breathing, where you're taking in really deep breaths, there is space for this. There is space for the lungs to expand into this costodiaphragmatic recess. So that is a physiological reason why that space is there. Now, a medical reason why that is there is that you may need to have a fluid aspiration from the pleural space. And if you take fluid from anywhere in the first 7 intercostal spaces, you're going to risk hitting the lung and puncturing the lung. So what you want to do is, and different sources are going to tell you slightly different things, is you want to take a needle and put it into the intercostal space mid-axillary line between intercostal space 8 through intercostal space 10. All right, so it's important to realize that that is going to be the only spaces on either side of the lungs, mid-axillary line, where you don't have lungs and it is safe to put in a needle, aspirate fluid without causing any organ damage. So now that we've talked about the pleural membranes, and again, remember those form the lateral boundaries of the mediastinum. I'll use a different color. The lateral boundaries of the mediastinum right here, those would be the mediastinal pleura. But the mediastinum also has other boundaries as well. Notice that in addition to the mediastinal pleura, the sternum forms the anterior boundary, all right, and you can see that right here. The vertebral column posteriorly, all right, and notice that in the vertebral column, the mediastinum goes from thoracic vertebrae 2 all the way to thoracic vertebrae 12, where that costodiaphragmatic recess is going to sit. The superior thoracic inlet is the superior border, and of course that is defined by the first rib there. And then the inferior border is the diaphragm. All right, the diaphragm forms the inferior border of the mediastinum. Also notice that the mediastinum is divided into sections. So you have the superior mediastinum, the anterior mediastinum, the posterior mediastinum, and then the middle mediastinum. All right, and we're going to talk about what those are and what structures you can find in each one of those mediastinal areas. All right, well, starting with the anterior mediastinum right here, which is located right here, and that would be just in front of the medial mediastinum, which of course, if you look at it, that's right where the heart would be sitting. You're going to find very few structures because it's a very tight space, and the structures you can find are the thymus. So you can see that at the bottom here, the thymus covers almost all of the anterior mediastinum. And also you'll have loose connective tissue between the thymus and the sternum, and the thymus and the structures that are behind it, including the heart. All right, the middle mediastinum, notice that we talked about this already, that it's kind of where the heart sits. It is where the heart sits. Posteriorly, it sits between vertebrae T5 to T6, 7, 8. So between T5 and T8. And in that, of course, you'll find the heart. We talked about that. Surrounding the heart, you'll have a double membrane sac, kind of like the pleura of the lungs, and that's called the pericardium. You'll have the origin of the great vessels, aorta, superior vena cava. That's going to be there in the middle mediastinum. And then you will have the phrenic nerve as well. Let me get a different color for that. Let's do yellow. You'll have the phrenic nerve traveling down here on the left and here on the right. So I apologize for this slide of the superior mediastinum, because in translation from my PowerPoint into this program that I'm doing these recordings on, you see all of the words got screwed up compared to your PowerPoint. So I'll be talking about this, but refer back to your PowerPoint for this information to be more clearly delineated. All right, so the superior mediastinum, this area right here, so it's above the middle mediastinum, and it's above the anterior mediastinum, and actually above the posterior mediastinum. Notice that you will find quite a few structures. First of all, you'll find the thymus. We saw that in the previous one, so that tells you that the thymus extends up here into the superior mediastinum. You'll find not the origins of the great vessels, but the great vessels themselves. So this right here shows you where the superior mediastinum would be, and notice that it is, you'll see the aorta here. You'll see the superior vena cava branching off into the brachiocephalic trunks, and then the branches coming off the aorta and the branches coming off of the brachiocephalic trunk as well. So that's where you will find the great vessels in the superior mediastinum, all right, listed here and here. You'll also find the trachea. So trachea, of course, notice that it goes behind the aorta and behind the superior vena cava and the brachiocephalic trunk. So it would be in this area right here. And then, of course, right behind that, you'd see the esophagus, all right, in that same area. And notice that the esophagus and trachea, you'll find them in the superior mediastinum, but they extend above the superior mediastinum and, of course, below the superior mediastinum as well. All right, so trachea and esophagus. Thoracic duct, you'll also find that. That's going to be over here. It's going to dump into the left subclavian vein. And remember that the thoracic duct is a lymphatic duct that is pulling excess fluid from tissues and dumping it back into venous circulation. And this is where most of your excess fluid gets dumped back into through the thoracic duct. All right, so keep in mind that we are in the superior mediastinum, and take a look at this picture right here, and that'll show you where the left and right phrenic nerves are. So the left and right phrenic nerves are just to the lateral of the left brachiocephalic vein and the right brachiocephalic vein. The left vagus nerve is over here just anterior to your left subclavian artery. And the right and left, or I'm sorry, the right vagus nerve and the left recurrent laryngeal nerve are on either side lateral to the trachea at the posterior border. So you'll also be able to find those things in there. So this will give you your first glimpse as to, where those nerves are located in relation to other structures within the superior mediastinum, so that you start to get a bigger picture of how everything is put together. And then we have our azygous vein. All right, remember azygous means unpaired. And even though it's not shown here, remember that it'll be on the posterior, the back of the thoracic wall, and it's going to drain blood from the posterior thoracic wall. One more key thing to point out is that your superior mediastinum, we drew the borders right here, but if you notice, there is a very specific structure that defines where it's located, and that would be your manubrium of the sternum. So if you find your manubrium of the sternum, between your jugular notch and your sternal angle, in between that would be where your superior mediastinum is located. And then you can definitely tell, all right, since I know that I'm in that region, I know what structures are going to be located there, generally speaking. This slide is just picking up some extra things that were not able to fit on the previous slide. So I drew in green right here, which will be the borders of your superior mediastinum. And just to point out again where the left vagus nerve is, just anterior to the left subclavian artery. The right vagus nerve, which is just anterior to the right subclavian artery, all right, as it goes above the superior mediastinum, but anterior to the brachiocephalic trunk, brachiocephalic artery right here. And then, of course, your left recurrent laryngeal nerve and your right recurrent laryngeal nerve running along either side of your trachea. All right, and then over here we see our posterior thoracic wall, and then we see our azygous vein right here, so we can see where it is located in relation to everything else. You notice that it loops up and around the root of the lung, so it's in the most inferior portion of the superior mediastinum. And then just a little bit about the thymus, and I think this is going to be the only place you hear this. So it will basically run from the thyroid gland superiorly, so the thyroid gland would be up here, to over the pericardial sac down here. And it's really large in children and infants, and will shrink over time as you move into adulthood, because it is involved in the process of T-cell competence or immune competence, a portion of the development of the immune system. And as that function becomes less and less over time, of course, the thymus is going to shrink because it's not needed as much anymore. And we'll cover more about that in physiology. And lastly, we have your posterior mediastinum. Posterior, of course, in relation to the anterior and middle mediastinum, and that is going to be inferior to the superior mediastinum. So we don't actually have an inferior mediastinum. We have the posterior. Everything else is inferior to the superior mediastinum. So the posterior mediastinum, notice that it goes from thoracic vertebrae 5 to all the way down to thoracic vertebrae 12. And in there, of course, you'll find everything that's going to be running along the back of the thoracic wall. So that's going to be our thoracic aorta. Notice that it runs down here along the back wall. The esophagus, again, along the back wall. Notice that the esophagus is medial to the aorta, all right? And that's going to be an important landmark to remember, especially as we consider the diaphragm and how these two structures go through the diaphragm. So start paying attention to that now. There will be the thoracic duct in there. So the thoracic duct will be right around in this area right here. Our vagus nerve will be in the posterior as well, and we saw that in the previous slide when we looked at the superior mediastinum where the vagus nerve was. So go back and check out that slide to do the comparison. And finally, the azygous vein. Of course, we talked about the fact that that is draining the blood from the posterior thoracic wall, so it makes sense that it would be in the posterior mediastinum as well, or it would traverse the posterior mediastinum. And this is just a continuation of the previous slide. So I just want to point out that here is your azygous vein going through the posterior mediastinum. All right, and if it goes from T5 to T12, notice it traverses the entire length of the posterior mediastinum. And then we also, which wasn't on a previous slide, we have our sympathetic trunks. All right, the sympathetic trunks located on either side of the vertebral column, of course, have connections directly to the spinal cord, and they're going to be found attached tightly against the posterior thoracic wall or against the body of the vertebrae along which they run. Earlier we talked about the diaphragm being the posterior border of the mediastinum, and here we want to talk about what the diaphragm is, what it does, and what are its innervations and blood supplies as well. So notice that it's connected here to the xiphoid process, and then it runs along the rib cage, the lower 6 ribs, and then against the posterior abdominal wall. On either side. That's where its origin is, and of course the origin of a muscle is where the part that doesn't move, and the insertion is where it does move. So the insertion point would be this central tendon right here, and that would be the portion of the diaphragm that actually moves as the diaphragm contracts and expands the thoracic cavity. So its action, of course, when the muscle contracts, this is going to move downwards, and that's going to result in an inspiration. And the innervation for it, we've already talked about, are these phrenic nerves that come down. So if you remember anything about nerves from this mediastinal lecture, remember the phrenic nerves. And the phrenic nerves are associated with the diaphragm and cause the diaphragm to contract during normal, regular breathing. All right, but there are structures that are in the thoracic cavity that have to traverse the diaphragm in order to get to the abdominal cavity. And so it's important to know what these structures are, where they pass through in the diaphragm, and in relation to each other. So at the level of about T8, thoracic vertebrae 8, the inferior vena cava passes through. All right, and notice that it is in the center of the diaphragm, just off to the right side. Center of the diaphragm, off to the right side of the vertebrae. So that's where the IVC is going to pass through. Passes through that central tendon. So as the diaphragm is being pushed downwards, it's going to slide along that, the central tendon is going to slide along that inferior vena cava. At about the level of T10, we have the esophagus that's passing through. And here's your esophagus right here. If you can't see that, I will use a different color. So the esophagus would be right here in yellow, passing through. And notice that it's just posterior to the central tendon and to the left side of the vertebrae. All right, so the inferior vena cava would be to the right side. The esophagus would be to the left side of that vertebrae. And finally, at the last one, at about the level of T12, the last thoracic vertebrae, you see the aorta, or the descending aorta. passing through the diaphragm on the most posterior side between the diaphragm and the vertebrae themselves. So the aorta would be the most posterior, the esophagus would be in the middle, and then the inferior vena cava would be the most anterior. So that would be the order they run in. The thoracic duct would actually run behind the aorta, and then you see the azygous and hemiazygous veins running through what we call the crura of the esophagus. So the crura are two little appendages that attach to lumbar vertebrae 1 and lumbar vertebrae 2 and lumbar vertebrae 3. So two little attachments that are the posterior part of the diaphragm. And notice that let me erase some of that. Notice that the aorta traverses between the crura in what we call the aortic hiatus. Okay, we talked about the left and right phrenic nerve as being the nerves that go to the diaphragm that give the signal for it to contract, and so you see that they pass through the diaphragm anteriorly and spread out to different regions of the diaphragm to cause contractions. So that would be the nerve supply. And the arterial supply, let me switch to red here, would primarily come from the left and right pericardiocophrenic arteries. All right, so peri surrounding, cardia, heart, cophrenic along with the phrenic nerves, arteries. So they would pass down and supply blood to the superior part of the diaphragm, and notice that they are branches off of the internal thoracic arteries or internal mammary arteries. And then the inferior phrenic arteries would come up and supply blood to the inferior side of the diaphragm, and those are going to be branches directly from the abdominal aorta right here. So finally, this slide shows the diaphragm. Of course, you have your inferior vena cava hiatus, which passes through the central tendon. You have the hiatus for your esophagus, which is just posterior to the central tendon and to the left of middle left of the vertebrae. And then you have your aortic hiatus right here. And on either side of that, you have your left and right crus, or plural, they would be called crura. And we talked about that, and that's where your azygous and hemiazygous vein pass through. And of course, remember, your aorta passes through here between the crura, and your thoracic duct passes directly behind that. Now, there's a video, I'll post this on Canvas separate from this video because it won't play in here, that will show you how the diaphragm moves, and you can imagine the diaphragm, the esophagus, and the aorta as they are sitting in their appropriate places as they pass through a diaphragm, how the diaphragm would move up and down those structures.